Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
Go above and beyond.
they become very good at what they do, but only
0.1%.
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
With Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. My guest today is Meier Miller. He's a clinic director for Restoration Dallas Chiropractic. So we're going to talk about the types of patients that come in and how he, works with the chiropractor to help them, et cetera. So welcome, Mark.
Yeah, thanks for having us. Appreciate it.
Yeah, if you would tell me a bit, you're not a chiropractor yourself, but why do you work in the field? How did you get here? Like, what's your background?
Yeah, it's pretty fun story. So how do you want to go in the long of it or the short of it?
Like a moderate, not too long, not too short.
So I actually was a patient first. Like a lot of people have misconceptions about what it was. I actually tell my patients this. So I served as used to be a pastor in Atlanta, and I had started having IBS issues, if you will, at around 29 years of age. I didn't know what it was. I just thought it was food related, but it kept getting worse. And so, I'm running to the bathroom 2 or 3 times a week, barely getting my pants off. And so I'm drinking my Lanta like it's water. Nothing's really helping. Everything in my life is kind of symptomatic at this point where I'm just putting Band-Aids on things. And I finally, at a work event, ended up pooping on myself. And so I was like, all right, this is ridiculous. We got to figure this out. I tell my sister, who was back in Dallas, and she goes, you can go see a chiropractor. And I'm like, this is the dumbest thing about you. You're super weird. You read some weird blog or something, whatever. Anyway, so I get off the phone with her. And the next day, my now wife calls me. She was in chiropractic school in Atlanta, which I didn't even know she was there. I'd met her before because she was best friends with my sister. She calls me and says, hey, your sister told me about your accident this past weekend, and you need to go see a chiropractor. And I'm like, I need to go see a GI specialist. I don't know what it is with you guys about chiropractic. She goes, well, I made you an appointment with this guy by your office. And I'm like, so she goes, please go see him and just go and see your x-rays and just hear what he has to say, and then you can make an educated decision about moving forward. So of course I wanted to kind of date this girl. So I kind of go and I kind of placate this whole situation. I'm going arms crossed. I'll get to the chase here in a minute. But anyways, long story short with this part, he ends up showing my x-rays, and I'm 2 inches, like from calling a GI and going down the surgery route because I'm obviously can't keep anything down my stomach. And he shows me my x-rays and explains to me the nervous system. First time any doctor's ever sat down with me long enough to explain to me what's going on and why I got in that situation to begin with. And it was fascinating. And so I was kind of righteously angry because it completely perfectly justified the reason why my hips were completely off. They're highly rotated. Found out I had no disc in my L5, S1, which those nerves that come out of that part of the spine go directly to my colon. So there's no way that stinking organ's working like it's supposed to. And it's going to lead to the symptom that I was having. And so putting medicine in me was not going to fix it. It was just going to regulate a symptom. So we start dating. She ends up opening her own practice. I help her. And so now that's what we do full time. We end up getting out of ministry. So we've been doing that for almost 10 years now. So that's how I got in it all.
The ministry, how does that dovetail with the chiropractic, or does it at all?
No, it does a lot, because just pastoring patients is the same as pastoring people in your church, right? It's just taking care of them. It just looks, the 4 walls are different, but I use leverage relational equity. We pray with our patients. I care for them just like I would, people to church. So, it doesn't matter to me. Just, it's still a calling of my life of taking care of patients. This is, primarily this is through chiropractic. It's just more physical, but we do a lot of emotional and spiritual and, other indirect counseling and just talking with people to make them feel heard and loved on, know they have a place. So it's kind of part of it. Just,
I would assume that not all the patients are of faith, do you mention things to like test and see if they're open to it, or like how do you guys work with patients differently? If I come in and it's my first time seeing you, like, will I be told anything special? Like, how does it work?
Yeah, no, it's a good question. So most people come in with, and they're in some need, right? So it's usually pain of some sort. And so when you walk them through, we take a full history of them, kind of figure out what all kind of traumas have you been in, the big traumas, what's going on currently, what's your main concern, and expounding all this stuff. So I want to know like when it's happening, how often it's happening, what do you try to do to make it better? And then I think the biggest shift, Richard, is we actually explain to them what we're actually checking for and why we're checking for it, and actually how it pertains to their specific issue. So we do a lot of education on the nervous system because no one really understands its role, even though we know it's crucial. We just don't really fully understand the explicitness of what it actually controls. And so I don't care if you're a man of faith or whatever, you got the same body I do. It's made the same way mine is. So regardless, you have needs, and I want to address those needs. So, and I can go into that just in terms of what we say and what we educate on. But I think that's probably the biggest premise is we're starting on the same grounding of, hey, here's how your body functions. Here's how your body actually goes about trying to fix something. And so if you compete with that, you're really not going to get to the core issue of the problem. You're just going to keep kind of using different forms of duct tape to try to fix this. So that's our goal, is to get to the cause.
Oh, okay. But how do you do that though? What do you guys do special to actually find out the root cause of what's going on?
Yeah. So I'll give you an example. I had this lady come in, 73-year-old. She had just retired and she's overweight. Her husband's in the hospital. She's like, Mark, I got to get healthy. I got to start. I'm not going to end up like my husband. And I'm like, great. I'm like, I love it. Let's go. She goes, however, how in the world are you going to help? She had sciatica pain down her left leg, bladder incontinence. She had a lot of GI issues and back pain. She goes, how in the world does a chiropractic adjustment fix my bladder issue? I kind of get the muscle stuff because the spine's in the back and muscles, and you kind of move the bones, it takes less pressure off, kind of a thing, and it makes it feel better. I go, that's a great question. You're kind of skeptical like I was, just like make it make sense. I've also had this exact same conversation with my brother, who's been a medical professional. He was at Vanderbilt, now he's a concierge doctor in Nashville. The exact same conversation with him. He's like, I don't understand how y'all make these claims about heart disease and cancer. I go, hold on. Let's talk about what organ in your body controlled is your brain. That's what I'm telling this to the same page. She goes, your brain. I go, what does your brain do? She goes, I don't know. I go, yeah, you do. I go, what does your brain do? Does it send signals? I go, through the what? The nervous system. To where? He goes, I guess everywhere. I go, yeah. I go, your brain controls every aspect of function in your life. So nothing works. Like no hormones can balance, your muscles can't move, your stomach can't digest food, you can't produce the right amount of stomach acid, you can't produce, like nothing works unless signals come from your brain down your stinking spinal cord, out through all these nerves to literally control and regulate and heal every cell, tissue, organ, muscle, tendon, ligament. I go, but guess, and I told her, I go, well, guess what surrounds and protects the spinal cord and those nerves? Your spine? I go, yeah. Your spine fully surrounds your nervous system, and your skull fully surrounds your brain. So this brain and nervous system is the only system in your body fully encased in. She goes, huh? I go, yeah. What by default, what does that mean? If it's the most protected, what does it mean? She goes, probably most important. I go, yeah. I go, not just because if you mess with those nerves, you get pain. I go, you can, but more concerning, and what I'm ultimately more concerned with is if you put pressure on a nerve that controls the heart or your colon or a specific gland, I go, it's not going to function and heal like it's supposed to. So it decreases in function. And at some point it diseases. It's getting further away from its natural state. And then then the body says, hey, we have a problem, and it becomes symptomatic. And so then we put all energy on the symptom. I go, but the problem is I'm always going to start with nerve interference because that's what controls everything. And then I'm going to move to nutrition and then, mindset and talk.
Oh, besides nerve though, what about blood flow? Again, a nerve could be, I guess, pinched or compromised. I mean, it's not just nerves too. Like you could have a joint that's open and like the muscles and maybe the tendons and ligaments are trying to close the joint that's swollen open. I mean, I think there's like a lot of physical, mechanical things that could cause problems,
Right. Yeah. So there's trauma, right? There's scar tissue and things like that. But again, ultimately the nerves are what control the muscles that create the inflammation, right? And so, and same like blood, people are like, well, we'll talk about blood stuff. And I'm like, well, what controls the heart that regulates all the blood in the circulatory system? Like, it's the nerves. That's what's created in the first place. So I'm going to always start there in the nervous system. And then how we do that is we check x-rays, because that lady goes, well, how do you know if there's pressure on a nerve? I'm like, well, I'm going to take x-rays of your spine, because if your bones are in a specific position, kind of go back to your point, if there's joints that are malshapen, or there's degeneration in bones or discs, or there's deformities, or the structure's not off, then I can specifically pinpoint where it is putting pressure on a nerve that's causing not just pain, but dis-ease and disjointedness. So there's a specific structure we look for. Spine has to be straight from the front. You have to have level hips, and then 3 45-degree curves from the side. So that's optimal.
Okay. again, what's I don't know, what does that mean for the patient? Like, the chiropractor will do the normal adjustments. Will they do something different to address the nerve function? I mean,
In other words, like what happens like after we take x-rays, what do we do from there?
Oh, so that's what you do first is you'll do x-rays. Okay. And then, what do you guys do differently that other chiropractors may not do?
So x-rays is a big portion because most chiropractic, and this is kind of one of the biggest misconceptions, is it's just for pain relief. And a lot of chiropractors use it for that. And some that's how they're educated, and some it's a principal thing. And that's a big chasm that I don't, it still kind of baffles me at this point because I talked to my wife, I've talked to other colleagues that I'm really close with, and I'm like, I don't understand how y'all come to different conclusions about the expansion of your actual practice, how some can use it just for musculoskeletal or just for pain, and then some use it for full healing because you understand the nervous system. I'm like, but we take x-rays and then we do an exam. And so we do a lot of preliminary checks and balances to very specifically pinpoint where their issues are. And then we do a lot of education on how to read x-rays for our patients because I want them understanding why we're recommending what we're recommending and why this goes way beyond just pain care. Because what happens is, again, a big misconception, and it's hard to work past this, is my health is only related to how I feel. So as long as I'm feeling good, I must be considered healthy, but that's not how the body, it's not accurate. And so we have these big misconceptions that if I feel good or I'm non-symptomatic, then I must not be developing a disease problem or my body's is 100% fine. I'm like, it doesn't work that way. So we have to start way back at square one and say, listen, your body is this unbelievable healing instrument, and in its most natural state is healing. When it becomes symptomatic, it's already lost a lot of functionality. It's already lost the ability to repair. And it's just now finally letting us know, unfortunately. And so again, most people's goal is to get the symptom to go away. So we do this big educational process called a report of findings, and it's usually about 45 minutes to an hour. And then we give our recommendations. Here's what the doctor recommends. And it goes well beyond pain. So you should be getting better in 2, 3, 4 weeks, depending on how severe your problem is. But I want to continue seeing you because I want to not just get past your pain points, get your arm feeling better or your low back or whatever. I want you to move corrective problems that are continuing to aid in this issue in the first place and then bring you into a state of wellness. It'd be the same thing of if you hire a lawn guy to come to your house and he's like, and your grass is all dying, you're like, well, what is it going to take to get my grass graded? He's like, well, we're going to need to fertilize it and you're getting to water it every day for 3 weeks. And you do that, but the grass still isn't green yet. You're like, well, I know, but it takes another month for the signs to actually show life. Does that kind of make sense? It takes time for the expression of that to show itself.
But I would think most people would come because they have a problem, some kind of pain, and then they would experience after a few adjustments or, maybe even one, at least some temporary alleviation of it.
Absolutely.
But someone that's not symptomatic that still, thinks they feel fine, why would they ever be motivated to come in? It just seems like most people, including myself, you don't do anything unless you're hurting.
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
That's right. Unfortunately, yeah, that's exactly right. It's a hard myth to kind of break through.
Yeah, even people that get treatment, I can hear them, how many times do I have to come back? I go to the chiropractor all the time. I love it. I don't need anyone to tell me to go because it always helps me. But I don't know why so many people are like, oh, I don't want to go because then they're going to bug me to come again and again. And I don't want to do that. Why wouldn't people want to do that if they feel better? I don't get it.
Yeah, I agree. And I think some of that comes down to because this is what's hard, because some people come in from different offices and I've done this, I've tried this. I'm like, I don't know what they did. I don't know what they didn't do. I know our intent, and I know when our doctors put their hands on patients after they've thoroughly assessed your x-rays and your history and your exam, what they're doing is very specific. And so we get results. We get results pretty quick. And we also do a lot of physical therapies with our adjustments at home. We have our patients do physical therapies at home because, again, you can start feeling better, but if your neck is still straight, you don't have these proper curves in your spine, then it's also continued to contribute to the problem that got you in here in the first place. So I kind of had a girl the other day goes, I don't understand that. I go, well, it's if I'm running the highway system on, in Dallas, Texas, I go, I've got to remove interference off the highway. So I got to take car accidents off the highway. I go, but you're operating on one lane of traffic. I'm trying to also give you back 4 or 5 lanes of traffic. So you're operating on more freedom and then sustaining that freedom in your body to then live at that higher state of functionality. I can't undo damage. I can't undo trauma. It's hard to do that stuff. I can keep it from getting worse though. I can keep arthritis down. So let's sustain it, right? And that's the desire to keep going.
Do you guys deal with injury patients or just more regular, like, back pain, neck pain type stuff?
Any and all of it. I have seen almost, it's
what do you mean bizarre?
I've had, fertility people, and I've had MS patients. These chronic diseases that are irreversible autoimmune diseases that you're like, this isn't getting reversed, but like they get off medications and they don't have to go to like their medical treatment because they're like, I don't need this anymore. And their doctors are like, I don't know what you're doing, but you don't need this anymore. It's like just stuff that you're like, unheard of. And I'm like, it's awesome. It's incredible.
Yeah, no, like when I've, when I feel like I'm starting to get sick, I go and I get adjusted. And if I am sick, trying to make sure I'm not contagious, but I always feel better after I get adjusted. I feel more awake and more alert. Yeah. My head will feel sludgy. I feel tired. And after I get adjusted, every single time I feel more alert and just clearer and better and more relaxed. And sometimes I've had, like breathing problems with asthma and I've been adjusted and it clears them up. And it's just amazing. It really helps. It's not everything, but it helps a lot of things,
it sounds no, and it's awesome that you recognize that in your body. It sounds hokey until you experience it, at least from a good chiropractor. But there's a lot of reason behind it, and a lot of it's anatomical, and that's what's so hard. Is you're like, if you get an adjustment on your C1, there's a ton of nerves that come out of the upper part of your spine, and they go straight to your pituitary, your pineal gland, and they go to your sinus cavities and your eyes and your ears. So if I take pressure off that nerve, and now the brain signals can reach those nerves and send those signals and restore that function, then guess what happens? What happens when water gets unkinked from a garden hose and it gets on the grass? Like, it's going to produce more life. So sinus cavities, histamine restores, vision, hearing, but there's like a lot of white blood cell count that gets controlled from the pituitary and your pineal.
You know what's one crazy thing that you guys probably don't do? I highly doubt it. But I had it done once. There's this one crazy chiropractor. He had like this little balloon and he would put it up your nose and then expand it for a second. And it adjusted my sphenoid like back and upwards. And I was like, holy shit, in the chair when he did it. And then he's like, all right, I got to do the other side. I was like, okay. So he did it, but it was crazy. And it changed my voice for like a few weeks and my breathing improved. But the feeling of like inside the middle of your head, your sphenoid cracking backwards and upwards was like, whoa, what the hell is going on? We don't
do that, but we've got patients that have had it.
Oh, really? Have you ever tried it?
Mm-mm.
It's interesting. It's crazy. And, you may say, I'm never going to do that again. But it was certainly interesting. So that's like the most invasive or crazy adjustment I've ever got.
Yeah, sounds like it.
Yeah. Anyway, so what do you hear from patients? Like, what are the main reasons that they come in? What do they tell you is bugging them?
Yeah, so, most of it's going to be pain, right? It's low back pain, it's upper back pain, it's neck pain, it's mobility. But we are starting to see, and it's really interesting, even like in the 10 years we've been in practice, like these trends already shifting. Primarily it's going to be pain-based stuff, which is fine. But we're starting to see a lot more like, hey, I'm having digestive problems. Can you help? Because I've done the gamut of GI, doctor, physician, da-da-da. I've been on medications for 5 years. It's not getting better. But someone told me to try this out. And you're like, yes. And then it is bizarre, but not. Like when you look at their spine, their middle part of the spine, which all controls digestion, is a mess. We're seeing a lot of digestive stuff. We're seeing a lot more anxiety, stress, depression, like emotional. There's such a big connection between that. And we're seeing a lot more of that. I can't sleep very well. I'm fatigued. So there's some hormonal imbalances that we're seeing a lot more of. And this has actually happened, a big kind of twist in the last couple of years. We've seen a lot more women come in for fertility issues. We've had a handful. It is so bizarre until you start kind of following these trends, because a lot of it's empirical, at least in my office, where a mom has tried multiple times to get pregnant and either miscarries or infertility issues. And the moms that we've seen in our clinic, and I could just speak for us, every single one of her hips have been highly imbalanced, and they're highly put so much pressure on those nerves that actually control the uterus. And so it's unfortunate, but the body knows it's not able to carry a baby. And then it's unbelievably rewarding when they finally get pregnant and they carry a baby to term. And I can't tell them who they are. I can't tell patients, hey, this is the mom, because they haven't, it's a HIPAA violation.
It's really cool though. That's really cool.
But it's like seeing these little rugrats running around her office, and I'm like, she tried for 10 years and couldn't do this. And
do any of the mothers name their kid subluxation in honor of it? This is my son, subluxation. Nice to meet you.
That's exactly right. Yeah, right.
That's really cool, though. That's I can see how that's like amazing, you know? That's really, really cool.
Yeah, we also starting to see a lot more kids too. I think that there's a lot more trust developing, especially like this younger generation. Like Gen Z is very open and not just.
Yeah, my kids used to go. Well, they still do. Now they're teenagers, so they kind of complain. I'm okay, you know. You don't need that. I'm like, yes, you do. But when they were little and they would get adjusted, they would get so much energy. It's like you gave them sugar. They would run around like crazy once they were adjusted, you know. And so that's how we knew like it helped them. They felt better.
It's weird and not weird. Yeah.
I don't know if you noticed that, but yeah, they got a lot of energy after they were adjusted.
I noticed it with my own kids and then kids in our office. Yeah.
Do your kids do the same thing, or do you notice other kids do that?
Well, our kids have been adjusted since birth. So
No, I mean, but every time when they get adjusted, do they suddenly get more energy and like run around like crazy, or does it not seem to affect them like that?
it depends. Sometimes they calm down.
Oh, okay. If they're hyperactive. Oh, interesting. Because they're out of balance. I see.
So it's gonna regulate. It's weird. Sometimes they'll crash. They'll be like, and I'm like, you were out. Like you
Okay.
reset.
What about people that have anxiety or depression or that kind of stuff? How does it affect them, the adjustments that you've seen?
Yeah. So it gets a little tricky because I'll give you a case on this, right? Like with one of our patients, she came in and she came in for low back pain. Right? That's what we do. And then we get into her spine. We dig into her history, and oh my, if she had the biggest like covering was like you had no idea. Coming to find out, this girl, 29 years old, had 6 different personality disorders. So lots of anxiety, lots of depression, manic, seizure. She was having like a seizure disorder. She was having like 4 to 5 seizures a week. So there's lots of depression for like pretty much her entire 20s. She had some weird stuff happen with her volleyball coach. Like there's a whole bunch of things that are contributing to this, right? And I break down, I go, can I just talk to you about your, she goes, well, I have 4 neurologists that I see and da-da-da-da. I'm like, have they ever talked to you about your nervous system? She's like, no. So we do things different, which is surprising. So I said, listen, this is going to just hang with me for you. She goes, okay. She's like, annoyed. She's like, can you address my low back pain? I'm like, yes, I will, but let me talk to you about your neck. She goes, hold on. She goes, I go, your hypothalamus sits right above these pituitary and pineal glands in your spine. I go, when you have a straight neck like you do, I go, your spinal cord gets stretched out. You're jamming into these glands that start dysregulating. So it can exacerbate this regulation between your brain and your gut, because most of your serotonin levels are built in your gut anyways, which her gut was a complete mess too, because she's eating sugar and grains all the time. So we helped her with that as well. I'm like, we got to like fix both of these issues. And so it's bizarre because we have a ton of patients come in. She got better like within, and oh my God, Richard, it was crazy. 3 months, her seizures decreased by 75% after 15 years of trying all these other treatments. She had her first normal menstrual cycle. Her anxiety, depression got better. I mean, it was like she got off all these medications. I mean, it was like,
wow.
She ended up moving to Atlanta to go to chiropractic school. That's how crazy it was.
That's really cool.
But we have so many patients, and they say almost verbatim the exact same thing, because most of them don't come in for anxiety or stress reasons, but it's so pervasive in our culture, stress and stuff, that they say circumstances haven't changed, but I'm responding way differently than I don't. When we look at the correction in their spine, I'm like, you have consistently less pressure on those nerves that control those glands that regulate those hormones.
So you mean like someone could say, I used to get angry all the time at like the slightest provocation, and now I'm more patient, for instance?
Yeah, I'm not as volatile as usually what it is. I'm not as up and down. Yeah, I still have my boss. I still have no money. I still don't like my husband, whatever. But, I'm normally like a spiral, and I'm not doing that as much. And this is like 3 to 4 weeks after they start. It's crazy how quick.
That's really cool.
It's fascinating.
What have you seen in people? Like some people, I would guess, come and then they don't come back after a few weeks. And some do, and they stay for a long time and continue to be a client or a patient. What do you see as the difference? Like, why do people come back or not come back?
Yeah. So honestly, a lot of this is education. Like it's understanding, hey, ideally, because I had a lady, she goes, how long do I have to keep doing this? And I go, well, you can do whatever you want. I'm like, you're not beholden to me or anything. I go, but you're responsible for your health. So this is sort of the education on the front end. You're responsible for your health, not your insurance provider, not your pastor, because you're the one that lives with the outcome. So if you understand that, and I go, and if you understand like the necessary implication to keep pressure off your nervous system, then ideally you want to be doing this forever, because this isn't just about relief. Most of my patients, I've got patients that have been here with me that are like literally our entire practice, like 9.5 years. Right. And I'm like, now they're not in pain anymore. And blah, blah, blah. Well, why are they still coming? I go, because they're maintaining. I go, you do that with everything else. I go, you don't water your lawn until it gets green and stop watering. You don't brush your teeth and then not have cavities and don't brush them again.
What I've noticed is, the after I've been going for a while, you just get more aware of like how you're feeling. You don't just brush it off and like, oh, I'll just take some ibuprofen. My head hurts. Like, It's like, no, I'll go to the chiropractor, and I know as soon as they get adjusted, I walk out, I'm like, oh, headache gone, feel great. So for me, that's what I just noticed more about myself, and I know when I'm out more often. But I just want to go. I like no one has to tell me to go. I just want to go because I want to feel good more often. That's plain and simple for me.
Yeah. And it's great. The biggest pushbacks, right, is time and money, right? It's hard and consistency, and I'm busy. And I'm like, I know. Everyone's busy. Everything's busy. Your nervous system doesn't care.
Yeah.
Sorry.
What's the recommended frequency? And I'm sure it's different for every person, but what's like a general frequency? Once you're out of like an acute problem phase, like a maintenance level, what would that look like for people? Is it once a week, once a month?
Yeah, so most patients, so we kind of have like a corrective phase, which differs based on kind of x-rays and exam, how degenerative you are, and symptomatic, right? And that we usually start people out at 3 times a week for a season, and it could be 2 or 3 weeks, it could be a month, it could be 2 months, depends, then drop them down gradually for muscle stability and changes. And then most people, myself included, maintain weekly. There are some that can maintain every other week, but you either have to have like a really good looking spine and know how to handle stress well. And that's shifted too. I was in a meeting with a whole bunch of colleagues recently. There's a guy, he had been in practice for 50 years. And he goes, I used to be able to maintain people every other week. I can't do it. He goes, the state of like where people are so stressed out, and it wreaks so much havoc on our body. He goes, it's hard for people to even stay in like homeostasis, like just balance at even once a week. It's hard. So that's where like our bar none. And some people are like, I can't afford that or whatever. Like I get it. Let's figure it out, right? Let's do something. Something's always better than nothing. But our once a week is usually.
What about insurance versus cash pay? Is it better to have people think of this as a cash pay type thing if they can do it? Or is it, do they have like, if you have insurance, they give you like a certain number of visits and they restrict stuff and blah, blah, blah. What makes a better patient? One that says, oh, I want to use my insurance, or one that's just open to like, all right, you gave me a good rate on cash pay, I'll do that, and I don't have to deal with any of that junk.
Yeah, no, and this is a big struggle, right? So we specifically chose to be out of network, which is a harder road to get patients, right? However, we have found ways to make care affordable. So that's part of our education process, is realizing, hey, insurance's goal is to not get you. Well, I'm paying for it monthly and it's $500, $600 I get, and you're like, I got it. So if it can benefit, then yeah, we're gonna use it, right? If they cover a couple adjustments or a portion of your copay, then yeah, we'll leverage that as much as we can. But you need more than the 12 adjustments that they think is going to need you to get to feel better. And that's
right.
all you can go read definitions on what is medically necessary. And it's all like, it is basically like,
well, they have no idea. They just use, if you layer like insurance on top of regular healthcare, it's like garbage layered upon garbage. For regular healthcare, it's forget it.
We've had like international people like Somali, they find us and, they'll move back to France or wherever. And they're like, we do this completely opposite. I'm like, no, I know we're very symptomatic. And it's hard though when you're like, but I need my insurance to cover for it. And I'm like, well, I hate to tell you this, you've been lied to. It's not their responsibility to get you better. Like your health is your responsibility. And unfortunately, insurance's goal, especially how they see chiropractic, is more therapeutic, right? It's kind of like almost like massage. And so if you're not getting better after a certain amount of treatments, and this treatment isn't helping, and so we're not going to cover this anyway. So when people say, well, but I get 30 adjustments, I'm like, you really don't 30 adjustments. I have to justify those 30 adjustments. And I can't justify those medically necessary unless you're in acute pain. But if you're in pain after 30 adjustments, then the treatment's not working. So I'm like, and you're not getting better. So some people are like, well, then just adjust me once a month so you can keep, and I'm like, but then you're not getting better. You're staying in this like symptomatic state. So how about we forget insurance altogether? How about I work around that and I make care more affordable to where you pay out of pocket and you get better care because they don't know what you need. They're reading some piece of paper saying, hey, you need this and this. We're not going to cover x-rays. I'm like, but they don't know. So we played that game and we benefited on the side of the patients because I want to help you. I'm like, good gosh, this is ridiculous. And then patients, I'm like, all right, we end up realizing because we make it affordable, it's got to be, especially if you come frequently and regularly, like the dentist, you're going twice a year, this is different. So it's affordable. It's not cheap, but it's also like, what do you value? I'm like, you're wearing a $500 watch. And I'm like, you can't pay for a $37 an adjustment. We got a problem. That's a $2,000 phone in your pocket. Well, but I pay monthly on it.
Yeah, sure.
But what do you value though? Like, this is your health. I'm trying to so we had those conversations and sometimes they're hard. And sometimes people are like, well, this isn't for me. I'm like, okay, I understand. I'm like, all right.
Yeah, that's crazy.
Try to keep the door open and I don't want to burn bridges. It's not my goal either.
All right.
And I understand this isn't for everybody. Like for the sake of like our office isn't for everybody. I think everyone needs chiropractic because everyone has a nervous system, but.
So what do you see as the future of the clinic you're in? Where, what new things are you guys working on? Where are you headed with treatment?
Yeah. So right now we're trying to make things simpler for our patients, so more efficient. And so a lot of that's going to come with like automation. So it's just some technology to like text things through to automate paperwork and efficiency in our office. And that's kind of what we're focused on right now. As a practice as a whole, I really see in this chiropractic becoming a lot more mainstream from a healthcare perspective versus this kind of side pseudo redheaded stepchild, to use that analogy, kind of alternative health kind of model. It's becoming a more mainstream. I think because people are fed up with the medical model, and I know there's definitely a time and place for that for sure. But I'm running in and out of these offices. I'm on 15 meds, nothing's helping, and it's just keep band-aiding. And then I've tried this, and it's not working. And then I tried this for a week, and I don't understand why. It's just, I think people are being burned by that system, rightly so. It's not designed for that. It's not designed to heal. It's just designed to regulate symptoms. So I think it's becoming more mainstream and more accepted, and people have their bad blood with it because there's some bad chiropractors out there, just like there are medical.
Okay. Well, very good. Where can you help people? What kind of radius or area do you work in?
So we're in Dallas, and it kind of depends. I mean, good gosh, I've got people that drive two hours round trip 3 times a week. And I got people, that live a minute away. They're like, oh, I can't get there. And you're like, well, we help people all over the Metroplex, but we are part of a network called Maximize Living, Max Living. It's a coaching network, but they implement chiropractic in what we call the 5 essentials. It's like a healthcare model. So chiropractic, quality nutrition, exercise, oxygen exercise, minimizing toxins, and then the mindset component of healing. So all those different puzzle pieces that aid in healing. And so we educate on those. We do workshops in our office, and there are lots of Max Living offices all over the U.S. And so I'll ask patients, I'm like, hey, who do you know that needs help, that needs to hear about this, even if they're not local, because I can find colleagues anywhere. So there's a website called maxliving.com. In the upper right-hand corner, it'll say find a clinic. And you type in your zip code and it'll tell you who's nearest to you. And sometimes, they're not everywhere, but there's about 500 clinics all over the U.S. Some in Puerto Rico, some in Canada. And we practice very similarly corrective care chiropractic, not just pain management. We're all trained very similarly. It's incredible. Highly, highly specific, highly missional, very relational, awesome. So it's a really cool mission to be a part of. And our goal kind of as a movement is to basically transform health, because people are sick and dying and they're thinking the bottom of a pill bottle is going to help them. It's just not. That's not what it's designed for. And so, and so we kind of educate and say, hey, like your body's made to heal, but not that way. So, but it's okay. It's neat.
Well, very good. So what's the best place for people to go, like a single spot where they can learn more about, y'all's method and schedule to come see you?
Yeah, so our office, we're in Dallas, kind of Dallas proper, kind of by White Rock Lake. Our website's restorationdallas.com. That's probably the easiest. And you can make an appointment there. You get our phone numbers there. And that number you can text on, which we respond to pretty frequently. That's probably the best place, honestly.
Okay. All right, well, very good. Well, Mark, thank you so much for coming on the podcast and explaining. And, I like how you guys have a very different way of going about things and a very different insight into chiropractic. So thank you for being here.
Thanks, buddy.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.